Now you are very good students, okay? I think you will be very good doctors, okay? You need to take care of your patients, okay? And say whatever is right. Never mind about the conditions. Say what you think is right, okay?
Thank you very much.
Bye-bye. See you.
With your stethoscope, with your torch, with all your instrument should be with you while you start to practice. This is the first thing. The second thing is to be patient with your patient. Be calm with your patient and be patient with them. Keep their secrets, طبعا. I know that all of you are going to keep their secrets and be very good observers to all what happens around you in the hospital. Observe well the seniors, what they do, and if you are in their place, you are going to do the same or you are going to do something else in dealing with the patient, in dealing with the
colleagues,
juniors, in dealing with their colleagues, in dealing with their professors. If you will be good observers, you are going to learn from the good things and the bad things which happen around you. Be good observers to all what happens around you, especially from the seniors. Observe very well the seniors, because when you observe them and the professors, you can either follow them or correct what they do, because you look only, you are not in the situation, and you see the feedback of the action and so on, so you can judge properly. It's better that if I do so, if I am in this place on the long run. So be very good observers of all what happens around you while you are, especially the communication, because to be a doctor you have to have a very good communication skills. Yes, المعاملة. Especially with, as I told you, because since your first day of working, you deal with many different levels of people. You deal with the professors, we deal with the workers, we deal with the nurses, we deal with the patient, with different types of patients, and also
families,
and the relatives of the patients. So you have, in the past in Egypt, we call the doctor Al-Hakim, from Al-Hikmah, the wisdom, because many situations doesn't need knowledge. It needs to deal with wisdom more than with
theoretical knowledge.
With knowledge. And usually the patient has what we call ليس على المريض حرج. God even relieved. So if the patient is impolite, if the patient
forgive them,
tell you any bad words or anything like this, no حرج على الpatient, no blame on the patient. But the relatives, no, within limits. The only one who has no حرج برضو, the mother. If a mother brings for you her children and she is worried, she is anxious, she gives bad words, whatever, the mother is like the patient. No حرج على المother also. What else I would like to tell you? When you deal, as I told you, the communication skill is very important and it is accepted. I know that it is knowledge and it is a science and you can study communication skill, ethics and so on, but the practice is totally different than what you are going to study. So be good observers to know how to deal in different situations, and don't forget the wisdom in dealing with the patients and with the relatives of the patients. And study all your life. Every patient you are going to see, you are going to learn something from this patient and from his relatives. And every time you see a new patient, you are going to know new knowledge. Inshallah. But also I would like to tell you to try to translate your theoretical studying into applying and practical issues. At first, all of us, we face problems in applying what we learn to be practical.
There is a detachment.
Yes, yes. So this is why I told you now, start to read in the form of differential diagnosis. Check all the sites or all the books of differential diagnosis, because when someone complaining, for example, of the abdominal pain, it could be internal medicine, it could be surgery, it could be gynae, it could be whatever specialty. So you are going to, if you are staying in an emergency room or so on, you have to disseminate the complaint. So start to study in the form of the differential diagnosis, the causes of the complaint, what could it be, and some pharmacological medications. Its side effects mainly, and its doses, so as not to exceed the allowance dose and not to prescribe something which has side effects to someone or contraindicated to someone.
So Dr. Hussein Khairi's advice for us.
I don't know what to say. You can obviously omit whatever you want.
It's okay.
And the recording, but I mean, we've been meeting during the whole year and maybe before that, and we've been discussing so many things and what to do and what not to do. And when it comes to adult advice, you know, you haven't got a lot of ideas. But I'm sure that there are three important things. The fact that you should be available all of the time to get the best chances to train and to learn. Meaning you should be in the hospital the vast majority of the day. I call availability. You should be available most of the time. And at times it works that you're working for shift hours and shift work, and this really undermines the quality of training badly. Okay, so this is one thing. You should be available. دي حاجة. الحاجة التانية, the other thing is that you should be really perseverant. Well, as we mention all of the time, that perseverance is the trait that you're required to do anything, and not the talent and not the skill. It is the perseverance. Well, you should protect yourself against being frustrated and depressed by not expecting a lot. It doesn't mean that you're not ambitious, but you should be very protective in this aspect. Do not expect a lot. When you don't expect a lot, whatever happens, you're happy with that, and this drives you more and more. But in the back of your mind, you've got a very high ambition. Okay, so you've got three basic things to follow. Don't bad, the aspect of sincerity, you know that, and the aspect of honesty, I'm sure.
Yeah.
I wish you all the best, and I wish to see you eminent clinicians anywhere in the world. Okay.
One question. Should you have to choose any specialty other than surgery, so what you will choose?
If I choose something other than surgery,
Yeah.
I think I would choose imaging. I would choose radiology and interventions and so on.
That's only question.
That's all?
Yeah, that's the only question. So thank you very much, Doctor, for for being with us all these years, especially after you become dean of the faculty.
Yeah, I've enjoyed you being with me very much. I'm sure you understand that and you can feel
Yeah.
it.
Really.
I really appreciate all that you've done during the whole year. I hope things work out well. I'm sure it will.
Sure. Thank you very much.